5 silent health warning signs often overlooked in the elderly welcome to your health partner. Have you ever thought, you're just growing older like everyone else? At first, everything seemed normal. You forget why you walked into a room. You pick up your phone, only to forget who you intended to call. One day, while driving home, you suddenly realize the familiar street seems strangely unfamiliar. A faint sense of unease creeps into your heart, but you shake your head and reassure yourself. It's nothing. Probably just tiredness. Then, you start gasping for air after climbing just a few steps. A slight dizziness hits when you stand up too quickly. Sometimes, you feel as if your legs no longer have the strength they once did. Yet, you continue to brush it off, because everyone says it's just part of aging, until one day, you slip and fall in the bathroom. No one hears your cry. You lie there, feeling an overwhelming helplessness with every breath you take, a chilling sense of loneliness and fear, perhaps a feeling you've never experienced so vividly in your entire life. It is at that moment you realize not all changes are natural. Some signs, if ignored, can lead to irreversible consequences. And you are not alone. Out there, millions of elderly individuals are slowly edging toward the brink of serious illnesses, simply because no one warned them in time. Sometimes, one gasp for air, one fall, one forgotten name. They're not merely signs of aging. They are the body's silent cries for help. Heart disease, Alzheimer's, diabetes, osteoporosis. These familiar names claim millions of lives every year, simply because early signs were missed. The good news is, if you pay attention early enough, things can still change. In this video, I will share with you 5 silent yet extremely dangerous health warning signs. Signs that, if detected early, could help you maintain your health, preserve your independence, and treasure the most precious moments with your loved ones. If you've ever experienced these feelings yourself, or notice your loved ones slowly changing day by day, leave a comment below. Share your story with us, because sometimes one small action today can save an entire life tomorrow. Now listen closely. Sign 1. Abnormal memory loss. When memories start fading, ask yourself, how many times have you walked into a room, only to forget why you went there? How many times, during a casual conversation with friends, you suddenly couldn't remember what you just said? You laugh it off. It's probably just old age. But if these forgetful moments start happening more and more, if even the most familiar faces begin to blur in your mind, then this is no longer just a natural part of aging. It might be the first warning bell of a much more dangerous condition, Alzheimer's. According to the 2024 report by the National Institute on Aging, unusual memory loss, especially forgetting new information or familiar details, is the earliest sign of Alzheimer's disease. The research also shows that even in the early pre-symptomatic stages, nerve cells in the hippocampus begin to degrade and die, quietly, without pain, until the memory loss becomes irreversible. Alzheimer's doesn't strike with a bang. It quietly fractures memories. A recent event that you can no longer recall. A familiar road that suddenly seems unfamiliar. A beloved name you can no longer speak. How can you differentiate between age-related forgetfulness and pathological forgetfulness? Remember the golden rule, normal age-related forgetfulness. You forget briefly, then remember after a while. You still remember familiar events. You occasionally forget without significant impact on daily life. Pathological forgetfulness. You can't remember even when reminded. You forget even routine tasks or familiar people. You repeatedly forget disrupting daily activities. Additionally, you should be particularly cautious if you notice other signs such as getting lost in familiar places, difficulty expressing yourself, or finding the right words. Unusual mood changes, anxiety, sadness, irritability without cause. A study from the Alzheimer's Association shows 80% of Alzheimer's patients initially think they're just experiencing normal aging until the disease progresses beyond their control. What to do if you notice these signs? 1. Note down every significant memory lapse. Write it down in a notebook or use a mobile app. Track the frequency and severity. 2. Take a memory screening test. Simple tests like the MMSE or MoCA can detect early cognitive decline. 3. Proactively schedule a neurological exam. A thorough neurological exam, along with an MRI or PET scan, can help identify early damage in the brain. 4. Exercise your brain every day. Play cognitive games. Learn a new skill, like playing an instrument, painting, or a foreign language. Keep up a habit of reading, journaling, and chatting with friends. 5. Focus on sleep and physical exercise. Studies show that good, deep sleep and regular exercise can slow cognitive decline. Remember, a small action today, like noting down a moment of forgetfulness or scheduling a health check, could preserve an entire lifetime of memories tomorrow. Don't wait until one day you look into the eyes of your loved one and realize that they no longer recognize you. If you witness these changes in a loved one, or you feel that something is changing within yourself, share your story with us in the comments below, because no one deserves to lose the precious memories that shape their life. Sign 2, Unexplained Weight Loss. When your body quietly cries for help, have you ever noticed? That old pair of pants that used to fit you perfectly is now loose around your waist? Sometimes, when you meet friends after a while, they might suddenly ask, "You've lost weight, is everything okay?" You smile and shake your head. "No, it's probably just because I've been eating irregularly." But when the weight loss happens without you intentionally dieting, when you haven't been working out hard, and each time you step on the scale, the needle keeps dropping, it's no longer a simple matter. According to the American Geriatric Society, unintentional weight loss, particularly if you lose more than 5% of your body weight in 6 months, is one of the strongest indicators of underlying health conditions in the elderly. Why does the body lose weight unexpectedly? Unexplained weight loss could be an early sign of several dangerous health conditions, including early-stage cancer. Tumors consume the body's energy, even when there are no clear symptoms. Heart disease. A weak heart reduces the ability to eat, digest, and metabolize properly. Diabetes. Unstable blood sugar levels cause the body to break down muscle and fat for energy. Depression. Loss of appetite, fatigue, and a general lack of interest can make individuals forget to eat properly. Metabolic disorders. These affect the body's ability to absorb nutrients properly. According to a study in the International Journal of Geriatric Nutrition, elderly individuals who experience unexplained weight loss are 2 to 3 times more likely to die within 12 months compared to those who maintain a stable weight. How can you recognize unexplained weight loss? Ask yourself, have I lost 3, 5 kilograms or more in the last 6 months without changing my diet or exercise routine? Do I frequently feel fatigued, have a poor appetite, digestive issues, or a dull ache in my abdomen? Do I feel weaker than usual, with my old clothes becoming too loose? If your answer is yes to any of these questions, don't ignore it. Immediate actions to take. 1. Monitor your weight regularly. Track your weight at least once a month. If you've lost 5% or more of your body weight in 6 months, make sure to see a doctor immediately. 2. Note any changes in appetite and digestion. Are you feeling nauseous, having diarrhea, or constipation frequently? These could be early indicators of underlying issues. 3. Schedule a general health checkup. This should include blood tests, liver and kidney function tests, abdominal ultrasound, and blood sugar and hormone level checks. 4. Maintain an appropriate diet. Eat smaller meals throughout the day. Prioritize energy-rich foods like milk, butter, fatty fish, and whole grains. 5. Incorporate gentle exercise. Walking, light yoga, or physical rehabilitation exercises can help maintain muscle mass and improve metabolism. Remember, a pair of pants becoming loose isn't just a sign of weight loss. It could be a silent cry from within your body. Don't wait until your energy is drained completely before seeking a solution. Being proactive today could save your health, longevity, and even precious moments with your loved ones tomorrow. If you or a loved one is experiencing abnormal weight loss, leave a comment below. We're here to listen and support you. Sign 3. Abnormal shortness of breath. When your heart and lungs are quietly cry for help, do you remember the last time you climbed a few steps and still breathed easily? Or recently, have you found yourself needing to stop and catch your breath after walking just a short distance, feeling as though your lungs couldn't fill with air? Or even when sitting still, do you feel chest tightness or shortness of breath, prompting you to open the window and struggle for each breath? If these things are becoming your new normal, be cautious. This isn't just due to tiredness or lack of exercise. It could be a silent warning from your heart and lungs. According to the American Heart Association, abnormal shortness of breath in the elderly is one of the most commonly overlooked early signs of serious cardiovascular and respiratory conditions. Specifically, light but persistent shortness of breath could be an early sign of heart failure. The heart becomes too weak to pump blood efficiently, causing a lack of oxygen to the organs. Chronic obstructive pulmonary disease. Lung damage makes it harder to exchange gases, resulting in reduced oxygen levels. Pulmonary embolism, a life-threatening condition that occurs when a blood clot blocks blood flow in the lungs. Severe anemia, a lack of red blood cells to carry oxygen to the tissues, can cause breathlessness. What's even more concerning is that research from the International Journal of Cardiology shows up to 60% of early-stage heart failure cases go undiagnosed, as the initial shortness of breath is mistakenly thought to be normal with aging. How to identify if shortness of breath is a warning sign of a health problem? Ask yourself these questions. Before, I could easily climb 3 flights of stairs. Now, do I get winded after just 1 flight? Do I feel short of breath even when resting, changing clothes, washing dishes, or doing light chores? Do I need to sleep propped up with extra pillows, or even sitting up to breathe better? Have I ever woken up in the middle of the night because of a sensation of suffocating? If you answered yes to any of these questions, act immediately. Immediate actions to take. 1. Schedule a general heart and lung checkup. This should include an ECG, an echocardiogram, chest x-rays, or CT scans if necessary. 2. Get a general blood test. Check for hemoglobin levels, kidney function, and electrolyte balance. 3. Track the frequency and intensity of your shortness of breath. Record when it happens, what activity causes it, and how severe it is. This can help your doctor diagnose the issue more accurately. 4. Start gentle rehabilitation exercises for heart and lungs. Under a doctor's guidance, deep breathing exercises, slow walking, and respiratory yoga can increase lung capacity and endurance. 5. Ensure a clean, oxygen-rich environment. Avoid exposure to smoke, pollution, and harmful chemicals. Ensure proper ventilation and fresh air in your home. Remember, your body never stays silent without reason. Each time you feel short of breath, it's a cry for help. If you listen closely, you can save yourself. Don't wait until you're gasping for air and struggling with each precious breath. Be proactive today to protect your heart and lungs from these small but significant warning signs. If you or a loved one has experienced unusual shortness of breath, leave a comment below. We're here to listen and support you. Sign 4. Falls and balance issues. When your body is no longer a safe place to rely on, do you remember the last time? You almost tripped just from stumbling over a rug? Or when you stood up too quickly and everything in front of you spun for a few seconds, forcing you to quickly grab onto the chair or table? You might think it was just a moment of clumsiness, a harmless mistake. But if these episodes of dizziness and loss of balance are happening more often, if you're no longer confident walking on familiar ground, be cautious. Falls aren't just about losing your footing. They could be a sign of serious underlying weakness in your body. According to the National Institute on Aging, each year, 1 in 3 individuals over the age of 65 experiences a fall. Falls are the leading cause of hip fractures, head injuries, and premature death in the elderly. What's even more troubling is that most of these accidents could have been prevented if the early signs had been recognized in time. Why are falls so dangerous in the elderly? As we age, bone density decreases due to osteoporosis, making bones more fragile. Muscle mass and strength decline. The vestibular system deteriorates over time. Reflexes and the speed of nerve response slow down, drastically reducing balance. A fall that might just cause a bruise in a young person could lead to hip fractures. The mortality rate within 1 year of a hip fracture in the elderly is up to 30%. Head injuries, including traumatic brain injury or brain bleeds. Rapid loss of mobility and independence in daily activities. How to recognize early signs of fall risk. Ask yourself, do I feel my legs or arms shaking, unsteady, when standing for long periods? Do I experience dizziness when turning my head quickly or when stepping downstairs? Do I find myself needing to hold on to tables or walls to keep my balance when walking around the house? Have I almost fallen multiple times in the past 6 months? If the answer is yes to any of these questions, consider this a warning sign. Immediate actions to take. 1. Practice exercises that enhance balance and muscle strength. Try standing on one foot for 10, 30 seconds, switching legs. Do knee lifts while walking or gentle yoga exercises. Start with the guidance of a physical therapist if needed. 2. Supplement your diet to support bones and muscles. Calcium, vitamin D3, and high-quality protein are essential for bone and muscle health. Follow advice from a doctor or nutritionist to meet your needs. 3. Get a bone density test. This will help detect early signs of osteoporosis so that timely interventions can be made. 4. Make your home safer. Remove slippery rugs. Secure loose electrical cords. Install handrails in the bathroom, bathtub, and along stairs. Ensure good lighting in hallways, especially at night. 5. Undergo a comprehensive fall risk evaluation. Perform balance and mobility tests under the guidance of a healthcare professional. Remember, a fall in the elderly is not just a minor injury. It could be the beginning of a series of loss of independence and sometimes even life itself. Don't wait until you're lying in a hospital bed, wishing you had taken action earlier. A small step today, like improving your balance or making your environment safer, can preserve your mobility and independence tomorrow. If you or a loved one is at risk of falling, leave a comment below. We're here to listen and help you stay safe. Sign 5. Abnormal mood changes, when heart quietly cries for help, but no one knows. Have you ever noticed? A loved one, once always cheerful and lively, suddenly becoming irritable over the smallest things. Depressed, sad, or withdrawn with no clear reason. Reclusive, refusing calls, shutting themselves in a room, or suddenly bursting into tears over what seems like a minor issue. You might think, maybe it's just old age making them more sensitive. But the reality can sometimes be even more painful. Abnormal mood changes in the elderly are not just a natural part of aging. They can be a silent cry for help from the brain and mind, signaling the development of underlying health disorders. According to the American Association for Geriatric Psychiatry, over 25% of people aged 65 and older suffer from depression, anxiety disorders, or mild cognitive impairment, and the first signs are often changes in mood. What's even more unfortunate is that most of these cases go undetected or untreated, because we often mistake them for normal aging changes. Why do mood changes occur in the elderly? Neurodegeneration leads to chemical imbalances in the brain, affecting serotonin, dopamine, the chemicals responsible for regulating emotions. Alzheimer's disease and other forms of dementia often begin with personality and emotional changes. Late-life depression can be associated with chronic illnesses like diabetes and heart disease, which rapidly worsen mental health. Loneliness and social loss can silently push the elderly into states of despair that no one notices. A major study in the Lancet Psychiatry concluded, mood changes lasting over 2 weeks in the elderly increase the risk of death by 1.8 times compared to those without emotional disorders. Warning signs to be especially aware of: sudden irritability or anger without any clear reason, persistent sadness or pessimism that lasts for several days, loss of interest in activities they once loved, withdrawing from social relationships or activities, sleep disorders, insomnia or excessive sleep, changes in appetite, eating too little or too much, complaint of feeling worthless, guilty, or hopeless. If these signs last continuously for over 2 weeks, don't wait any longer. Immediate actions you can take today. 1. Start sincere conversation and listen attentively. Ask gently with patience. Avoid judgment or rushing conclusions like, they're just getting older. 2. Encourage light activities. Take walks outdoors. Try painting, gardening, play soft music, or join a community group for activities. 3. Schedule a visit to a psychiatrist or neurologist. These specialists will assess the risk of depression, Alzheimer's, or early cognitive decline. 4. Create a positive, loving living environment. Regularly check in, visit, and engage in meaningful conversations. Maintain familiar routines. Eat together, read the paper, play board games. 5. Support nutrition and sleep. Add omega-3 rich food, vitamin D, and tryptophan. Build a sleep routine with proper rest. Remember, not everyone who is sad can vocalize their distress. Sometimes they just need a caring glance, a simple question, how's mom today? Timely attention today doesn't just save a single day of sadness, it can rescue an entire part of their life that's quietly fading away in silence. If you've noticed abnormal mood changes in a loved one, leave your story in the comments below. We're here to listen and help you find ways to reignite their joy for life. You just learned about 5 subtle yet dangerous signs of declining health in seniors. Unusual memory loss. Unexplained weight loss, persistent mild breathlessness, frequent falls and balance issues, sudden mood swings without clear reasons. These minor signs may hint at a storm brewing beneath the surface. Never underestimate them. Your body always speaks before it collapses. The question is, are we listening carefully enough? If you recognize these signs in yourself or your loved ones, don't delay. Act now. Take immediate action today. Schedule comprehensive health checkups. Consult specialists if any unusual symptoms appear. Share this video with your loved ones, because sometimes one small action today can save an entire life tomorrow. If you found this video useful, please like, subscribe to the channel, and leave a comment to share your story. We're here to listen. Because health is the most precious gift we can offer ourselves and those we love most.